Hi, this is Cathy Hanville, licensed clinical social worker, and I am recording this piece on telehealth during the stay-at-home orders. So, how fitting. So, I am recording it from home. I just wanted to give you a quick overview of telehealth in California to supplement the slides. I'm not going to cover everything. So what are your basics? You have to get a good HIPAA compliant platform that's going to give you a business associate agreement, which basically says that they're going to protect your client's information also as much as you would. You want to work with look through any privacy policies of any company you choose. Some of them have privacy policies that could be a little difficult for us in this field, so it's important for you to look at those. Generally not considered okay to practice telehealth with a client in another state. Obviously, I'm doing this during the stay-at-home order, and a lot of those regulations have been waived, but in general, during normal times, it's not okay. Make sure you ask your malpractice insurer if you're covered. It seems pretty standard now. I have CPH, and they say you're covered as long as you're following the rules. And, I recommend you take some classwork on this, but this is what you're doing right now. So, what do you have to do telehealth in California? First is you have to get informed consent from the client, which includes informing the client of any risks or limitations of telehealth services. And I'm going to go a little bit more in depth into what you need to let them know specifically. So it can be a separate form or integrated into your regular informed consent. I think many of us that set this up as the last minute because of recent events, have a separate form. And mine is fairly detailed, so I think a separate form is warranted. You need to give the client your license or registration number. I just put that on the form. You need to document reasonable efforts to ascertain the contact information of relevant resources in your patient's geographic area. So what that really means is, and I have this in my forms, which you can access at cathyhanville.com, is I ask the client, so who's your emergency contact, and what's the nearest hospital to you, and what's the address you're going to be communicating with me from. So I have that on file as a standard. And I'm going to go into more next slide, which is you need to verify where they are every call, because you need to be able to get them emergency services if they need them. And the informed consent doesn't need to be signed paperwork, but of course signed paperwork is always the best way to have consent, because then you have a piece of paper documenting it. But at minimum, you need to be documenting it in your files. It's also best practice to get a copy of a client's driver's license, especially if it's a client you haven't worked with before, just to verify that they are not a minor, and you're also verifying their address. What do you need in your consent? That the patient or client can withdraw the consent at any time without affecting their rights to any other services from you. Description of the potential risks, consequences, and benefits. Let them know that all existing confidentiality regulations apply, as do all existing laws regarding patient access to medical information and copies of medical records, and that you will not disseminate any identifiable images from the telehealth interaction to anybody without consent of the patient, which I think is obvious to us, but it needs to be in your consent. Each session, when you meet with the client, you need to verbally obtain and document the client's name and address at time of session. You're always, of course, assessing whether they're appropriate for telehealth. If, their symptoms are too severe, they may not be appropriate for telehealth services. You need to use industry best practices for telehealth, which is a lot of that's around getting a good, secure platform on which to do your sessions. So those are the things you need to do each time. So tips for best interactions. These are both for you and for the client. Using headphones so others can't hear you. And also it can sometimes reduce feedback. Bigger screens are better. I've done this stuff with people on the phone, but a bigger screen is better, and it's usually more stable. Sometimes when people are on the phone, they're wiggling a little, which can be a little make it a little seasick. As strong as internet connection as possible, preferably wired. But if you have a router, being as close to the router as possible. A well-lit area, especially at night. I know in here it gets a little dark at night because I have to have the curtains closed on one side during the day for confidentiality. Making sure you close out any programs, because there can be other programs that are open that are using internet that you're not even aware of, so try to close down any other programs. And of course, making sure you're on a secure network. That obviously is going to be more of an issue for them, the client, than you, probably, because some people might be like doing Wi-Fi in another place or something like that. Does insurance cover telehealth? So in general, California is one of 21 states that requires insurers to cover telehealth, as they would cover in person. That being said, some insurers call it out as a specific benefit and deny it if it's not in somebody's policy. So the best recommendation always to check and make sure. You also, at the same time, when you bill it, you generally need a modifier code. So along with your 90834 or 90837, you're going to use a modifier code with it, which is mostly 95, except when it's GT. And then your place of service is O2. But you want to verify that with the insurance companies, because different insurance companies do things differently. And while most insurance companies cover video sessions, they rarely cover phone sessions except in circumstances like what we're in right now. So that's important to know. In the resources, there's a list of platforms I recommend you look at. I would actually say if you're going to do an electronic health record, your best bet is to get a record that has integrated video. Like I'm using Simple Practice for my video sessions because my therapy notes doesn't have that right now. They are planning on getting it, so I will switch back, but it is sort of a pain. But it's nice to have everything all integrated. That's really important. And then there's a list of lots of resources that are available to you to look at for the future, so I really encourage you to also read the packet, but I wanted to give a quick video to just talk you through some things, just because, we hear information differently verbally than we do when we read it, so I thought that might be helpful to you, and that I could post this for other people, and they could find it helpful too. Thanks for listening.